This past year has shown us how technology, when used effectively and carefully, can help us to better connect with each other and improve the quality of our lives. Technology can also be vital to improving dementia care. With that in mind, it's a great pleasure to introduce our next presenter, Dr. Julie Robillard, who is an assistant professor of neurology at the University of British Columbia. She also works as a scientist experience at BC Children's and Women's Hospital in Vancouver. She's here to talk about the role that e-health technologies play in dementia care. Be sure to submit questions using the Q&A tab, and we'll answer as many as we can again at the end of the session. And now I'm really happy to welcome Dr. Julie Robillard.
Hi, everyone. Thank you so much for this introduction, and it's an absolute pleasure to be here with you today to talk about the role of e-health and other assistive technology in dementia care. So I'm going to start with some disclosure. I'm a co-founder and shareholder of an eye tracking and biometrics company, but I will not be talking about eye tracking today. And I receive research funding from the Alzheimer's Association, the AgeWell National Centre of Excellence, the Canadian Consortium on Neurodegeneration and Aging, the Canadian Tri-Council Agencies, and the Alzheimer's Society of British Columbia, but I have no conflict of interest. I also wanted to start with a disclaimer, which is that we're going to talk about technology, and I'll be showing images of devices that are commercially available that you can buy. And those are really meant to be discussed as examples, and I'm not, by way of this presentation, promoting or endorsing any one of these commercially available devices. And before I get formally started, I also like to acknowledge our participants in the research. A lot of our work looking at dementia is guided by lived experience experts. We call them our league. And so I'm very grateful for all their input throughout the research process. So for the next little bit, we'll cover very briefly what sorts of assistive technologies are out there. And then we'll have a bit more of a focus on socially assistive robots. We'll look into what they are, what they're good for, and why people don't tend to use them very much. Then I'll tell you about some of the research going on in this field right now. And then we'll close with 10 questions to ask when adopting a new technology. And that's any technology, whether you're thinking about joining a Facebook group all the way to thinking about a device like a smart home device or a social robot. So there's a wide range of technologies out there that can support us in our everyday lives. And the term assistive technologies is construed very broadly and includes everything from health information websites to mobile apps. In this example, it's an app to help with sleep, all the way to very elaborate or very sophisticated devices such as social robots. And these technologies can help with a wide range of activities, and I'm showing you 4 different domains for assistive technology here. So memory aids, of course, but also we have technologies that can help us with our activities of daily life, whether that's taking medication, writing emails, doing our finances, all those sorts of activities. We, of course, have technologies that are used for monitoring and safety. And then a very popular type of technology is used for leisure and connection, ways to connect with our loved ones and with other types of support networks. And so I'd like to follow this up with our first poll. There's going to be 3 polls with this presentation today. So just for me to know, to get to know you a little bit, would you use or would you consider using any of the following technologies that are described here? And I'm not entirely sure if I need to launch the poll, but I'm hoping Doug is going to do that on the back end. Maybe or maybe not.
Julie, you're good.
You're good? I'm good?
Yep.
Oh, it is. Oh, it is running. Oh, I'm so sorry. Okay, sorry, I can't see it on my end, but that's going to make it difficult to look at the results. So I'm hoping that you've now participated in the poll, and I'm not entirely sure what the results might be, but maybe someone who can see it. Sharon, can you see the results?
I can, yeah. We'll give people another moment here.
Excellent.
It looks like right now monitoring and safety is at about 83% of our respondents.
Great.
Leisure connection is about 78% of people responding. followed by they're moving around, activities of daily living, and each with about 71%.
Okay, thank you for that, Sharon. I probably will call on you again in a little bit. Thank you so much. So it's lovely to hear that that many of you would consider these technology. I certainly use some of these in my home, and they're increasingly popular, definitely on the rise in terms of use. And they're also increasingly helpful as we're learning about different technologies and the ways we can use them in our everyday life. Okay, so moving forward, I want to focus a little more on socially assistive robots for some of this talk. They're a newer technology, they're evolving rapidly, they have a lot of potential, so I want to take a moment to talk about these. But a lot of the considerations that I'm going to talk about here in terms of what socially assistive robots can do, some potential issues or concerns with them, some potential considerations for use, they really apply broadly to all sorts of different assistive technologies. So it's not necessarily going to be a unique case, but more of an illustrative case for technology in dementia care. So we know from some research that social robots can have some benefits for us. Interacting with social robots can decrease agitation and anxiety and loneliness and stress. And these things are so important right now during COVID. And we've definitely seen an increase in the uptake of these devices for these reasons. We also find that they can increase our quality of life. They can increase our engagement, including with one another, including between humans. They can benefit our communication, our verbal communication, and they can assist with participation in social activities. And so there's a lot of potential reasons why we may consider using a social robot. But they're not very popular, and I didn't want to have too many polls, but I would wager that most of you don't have a pet robot at home or a robot butler. Sometimes people think of them that way. And there's a lot of different reasons for that. There's a lot of different reasons why people don't use these robots, even though they're potentially beneficial. And I've put some of the reasons on the slide here. Many people tell us they didn't know the robots existed or that this was available to them. Some of these robot solutions are still pretty expensive, so that's definitely something that comes up. A lot of our participants and people we engage with tell us they just don't need that. Some participants are concerned about their privacy. Robots often have cameras. They can capture image and video. And then finally, some people tell us, I think that it would be awkward. I think it would be awkward to pet a fake dog or to have a conversation with an AI-powered robot. And these are all very valid reasons. And in scientific terms, we call these barriers to adoption. So I'm going to very briefly illustrate these barriers and the different ways in which they're preventing people from using these technologies and also experiencing the benefits. And the first barrier that I want to talk about is this idea of benefit. And on my slide with the different reasons, this would be people who tell us, well, I don't need that. I don't need a social robot. It's not going to be doing me any good. And that's not entirely, that's actually a good concern. The reality is we think that social robots can do these great things for us and decrease agitation and anxiety, but the truth is we still need more research. A lot of the evidence that we have for these benefits is early, small sample studies that only engaged a handful of participants, or studies that weren't controlled properly, where they didn't use another intervention that's sort of similar, so that we know whether those benefits are really because of the robot or it's just really because we're introducing something new in the environment. So we still need more research, and I'll tell you in a little bit about the different ways you can be involved in that kind of research so that we get more knowledge and stronger knowledge about the different benefits that social robots can have. We also don't all agree on what those benefits should be. So we did a co-creation workshop with adults, and we asked them about what sorts of application areas they would like robots to help with. And we had some areas where everybody agreed. And so we definitely want all the robots to do our house cleaning. And I definitely agree with that, and I have a vacuum robot at my house right now. So there's some areas where we know what kind of benefit we want from these devices, but there's other areas where we're not so sure. And so things like bathing and feeding, even dressing and grooming, there's not necessarily agreement. And you can see some of our participants told us robots should help with the activities. Other groups told us they shouldn't help with these activities. So we still need a bit more information, a bit more consensus on how to develop these devices in a way where they deliver the benefits that we actually want, and the evidence for those is very strong. The second barrier I want to touch on briefly is accessibility. So we talked a little bit about things like participants who tell us they didn't know that robots existed or they're too expensive. So those are accessibility considerations. One way that I like to illustrate how maybe not everybody can access the social robots the same way as with this map. So this is British Columbia, which is the province I'm currently residing in. And there are 3 colors on this map, and each color is home to approximately 1.4 million people. So you can see that the people in the yellow and the red area, they can go to Best Buy and get a social robot, or they can have Amazon delivered to their homes. But the people in the blue areas, they may struggle to access those same solutions. And so this is just one way to illustrate how still not everybody has the same access to assistive technologies. Another concern, or another reason why people are hesitant to adopt social robots or other technologies, is because they have concerns about ethical issues. This is, again, a very valid concern, and I like to illustrate that with the following headlines. So this is from a few years ago. It was an event that happened where a man was told he was going to die by a doctor on a video link robot. So this is an ethically dubious use of a telepresence robot. There are definitely situations where those robots are appropriate and situations where maybe they're not appropriate. And we're still trying to figure that out. We're still trying to engage with potential end users of these solutions and trying to get an understanding of what are they good for, when are they good for, and what is ethical in terms of using these. There's a number of other ethical issues, but instead of me just telling you about them, I would like to ask you about them in a poll form. So this is for my second poll for this presentation. And so I'd like to ask you, what do you think are the most important ethical issues in social robots for dementia care? And I gave you 5 potential issues here. One, people may think the robots are living things. So there's a very common ethical concern that we may be deceived into thinking the robot dog is a real dog. For example, 2, people might get too attached to the robots. There's concerns around that maybe we're going to form really tight bonds with robots in our home. 3, that robots may record and share private information. This is an ethical concern that's, again, very popular. It also applies to other technologies like smart homes, or anything that has cameras or speakers or microphones, sorry. 4, that robots may make mistakes when they're helping people. You can imagine if you have a robot that's helping you with your medication, you better hope they get the dose right. And they usually do, but that mistakes do happen. There's possibilities for that. And then 5, that robot may eventually replace human carers. So in the ethics literature, again, this is a big concern. My headline here on the slide is a good example of that, an inappropriate, potentially inappropriate use of a robot. And so I'm hoping that you can see this poll, and I will again turn to Sharon to enlighten me as to what is being answered.
I'm happy to help. It's kind of like the big reveal when I can tell. So right now, Julie, it looks like about 44% of the people who are responding think that robots might make mistakes when they're helping people. And then right behind that, it's about 40% of people thinking that robots might record and share their private information. And then we have a drop off, and about 15% are saying robots might eventually replace human carers, followed by people thinking that robots are living things or that people might get too attached to them.
Right. Great. Thank you for that. I should say that your votes reflect the attention that's being paid to these ethical issues for sure. The issue of privacy is definitely top of most minds when we talk about the ethics of robots. The issue of mistakes is also very important, and we have a very good parallel for that, which is self-driving cars. Self-driving cars, if they make a mistake, there's potentially health or life even implications for that. And so we definitely have these technologies where we can start studying these kinds of phenomenon and get a good sense of whose responsibility is it for the robots to do a good job, and things like that. But all of these concerns, I want to say, are very valid, and they're being studied extensively so that we can make robots that are proactive in how they address these concerns. Okay, and then finally, the last barrier I wanted to mention briefly is this idea of emotion. We want robots, social robots, to convey and understand emotion. It makes them better at being companions, at alleviating our anxieties and our stress. But there's definitely a threshold. We don't want them to be too good at it. And so there's sort of a sweet spot where we want to feel heard and to have the robot be somewhat responsive, but not so much that it becomes kind of creepy. And so some examples of why that's important or how that's done. On the left-hand side, some of you may remember, if I was in a room with you, I would ask you to raise your hand, but on the left-hand side is Clippy. And Clippy was a virtual assistant, not a robot, but a similar type of technology to assist us with our everyday tasks. It was a virtual assistant in Microsoft Word, and it sat on the corner of your screen. And if you struggled, some of you know Clippy, that's great. If you struggled, Clippy would try to help you. And if you've ever tried to do something complicated in Word, like put a table in a document or something like that, you can know that it can be very frustrating. And if you're encountering some problems and your virtual assistant is in the corner and it's doing a little dance and it's winking at you and smiling, that is not a good match to the emotion that you're experiencing when you need help with your computer. And so Clippy was not very famous. It didn't work very well, and people didn't like it very much. And there's a lot of reasons why that is. But in affective computing, which is the branch of research that looks into making computers emotionally aware, we like to use Clippy as a fairy tale of why it's important that your robot helper or that your virtual assistant is in a good place with you emotionally, and it gets what you're going through and it's able to respond to that appropriately. In the middle of the slide is Sony's dog Aibo. You might have seen it in other slides. Aibo has these very cool eyes that are sort of little screens, and that can convey emotion, and it also does a lot of things with its body. It can wag its tail and things like that, and so it conveys emotion a lot better. And then finally on the right-hand side is a robot called Cosmo. And Cosmo is extremely emotionally demonstrative, like it shows a lot of emotion. And that's because the makers of Cosmo had its eyes animated by Pixar animators, so the people who make those kids movies. And because of that, just with the way that it changes its eyes, you can see emotions like frustration, like anger, like jealousy, happiness, of course, contentment, and it's very, very well done. So all this to say, we're getting better at having robots that can display emotion. We're also getting better at developing robots that can understand emotion. What we're trying to pinpoint now is how much is the right amount of that interaction, and that's something we're very interested in my lab. So all of these barriers, of course, have solutions, and some of these solutions will take time, but the biggest thing that we can do to address the issues around what are the benefits that we want from the devices, how can we make them in a way that everybody who wants one can have one, how do we address the ethical issues, and how do we get the right amount of emotion, a lot of that can be done by consulting directly with the people who use them. And so we do that through co-creation workshops, through consultation, and then for the emotion bit, through modeling, through getting an understanding of what those relationships should look like. But it's very important that we engage the communities that are going to be using them and sort of addressing those problems before we make the devices, instead of having all the engineers come up with this cool thing in a vacuum and not really understanding how to best serve the end users. And so there's a lot of different research going on around the world on how to do that. We have one study going on in my lab called Disrupt, which stands for Designing Innovative Social Robots Through End User Participation. And there's two different ways you can participate. If you're interested, I will share them with you on the slide. The first one is we have a survey right now where we're asking for perspectives around robots and other types of information on sort of how we feel towards robots, and this is available at this link, which is bit.ly/UBC robot. UBC is for the University of British Columbia. And just in the interest of time, I'm going to move on, but I'm assuming these slides are available. Yes, excellent. We also have currently a suite of co-creation workshops that we're doing with people from all around the world. Unfortunately, due to COVID, or fortunately, depending on where you live, we're doing these online. And so if you're interested in coming over to a Zoom room and chatting with us for about an hour and a half, seeing some demos of what these robots can do, and just having a conversation about how we can design devices that do good, please drop me a line and I'll be happy to connect you. Okay, so for the last few minutes of this presentation, I'm realizing now that I forgot one of my polls, but we're just gonna skip it for the sake of time. So for the last few minutes, we talked about social robots. Some of you may think they look fun. Some of you may think not in a million years. Both of these attitudes are totally acceptable. But I wanna go over some questions to ask, whether you're considering a social robot, but also other types of technologies. If you're interested in using a mobile app to help you with your anxiety, or if you're interested in a smart home device to set things a certain way for you, there's a lot of different technologies out there, and it can be overwhelming to make a choice. And so I want to share with you 10 things to think about. So the first 2 things to think about is this device going to improve my quality of life? And is also going to benefit my spouse or my care partner. And this is something that's very important. The more people see the point of having a thing in your house, the more likely you'll get the most out of that thing. And so ask yourself, is this going to help me on a day-to-day? Is it going to be more good than bad? So the converse of that is sort of, is this going to stress me out because I have to charge it, or because it might be recording things? And we'll get to that in a minute. But the first thing to ask is this going to be a good thing for me? And is it going to be a good thing for the people who live with me? Of course, we need to think about how much these devices cost. One thing I also encourage you to think about is how much does it cost to use? So some of the devices may have a subscription package where you need to pay every month. So it's very important to know these kinds of things ahead of time. Another question to ask is, am I confident I'll be able to use this device easily? Does it seem pretty intuitive for you if you look at the packaging? Do you have friends maybe who use it, who know that it works well, it works easily? And is it clear who you can turn to if you can't easily operate the device? So is there a phone number you can call, or an email address you can reach someone at? 2 other questions around the ethics. So one question to ask is, do I understand the potential benefits and harms of using this device? And oftentimes with technology, the way you learn about the benefits and harms is through terms of agreement. And if anybody here has iTunes and you've once sifted through 50 pages of small font text just before you click I agree, that is sort of the worst thing that technology makers can do, because it's not very clear and it's not very transparent, and nobody reads those things. So is there another way that you can really understand what the benefits and harms? Is the technology developer doing a good job of telling you, for example, where your data goes, how it's being handled, whether it's being sold? You should be able to have answers to these questions before you choose to use the device. Similar to that, and sort of hand in hand with that, is this device going to keep your information private and protected? And if you can't figure it out, then that's usually a red flag. So you want the company to be very transparent about that. Do you trust that the device is of good quality? So now we buy things online. And so it's hard, we can't, touch them and see them and handle them before we buy them the way we used to. So do you have other metrics that tell you whether this device is a good quality? Again, someone who uses it is a great place to start. Is it a company that maybe you have other devices from that are of good quality? Will this device help support my independence? So again, sort of touches on the similar issues with quality of life. And then here we have some questions around the potential downsides of assistive technology. So how will this device impact my levels of stress and anxiety? So are you going to, again, worry about it being charged, or is it a social device and then you'll feel obligated to collaborate in a social way and that stresses you out? Is there other ways in which it may fuel your anxiety? So health anxiety and technology anxiety are very real considerations when considering assistive technology. And then finally, is this device aligned with your values? Does it fit into the life that you want for yourself? And is it a good fit for you personally? And so with that, I thank you for your attention and for your participation in the polls. And again, I invite you to be in touch with me by email if you're interested in either the survey, the co-creation workshops, or if you just like to stay in touch for future opportunities down the road, and some other pieces of contact information here. And I think we have like seconds for questions.
Julie, thank you so much. It's really fascinating. We hear so much about how technology use is growing, and we've experienced because of the pandemic, especially around dementia. It's really interesting to hear how you and your teams are approaching the research behind these. And it brings such a human factor to trying to understand the risks, the benefits, the potential for these technologies. So I really appreciate your presentation today. And I'm going to take a couple minutes for questions. Thing I think that's really on the mind of our audience today is how do some of these technologies fit with the different kinds of symptoms of different types of dementia? So, FTD comes with a whole lot of social interpersonal symptoms that are so directly related to the disease. I think people are really curious, one, if there's been any work that's been done specifically around different types of dementia and those symptoms, and then how does the nature of social connection need to be adapted, or how is it adapted given the symptoms of FTD where people maybe don't read faces the way other folks do, and those kinds of things? So if you could just take a couple minutes to speak to those, I think people would appreciate hearing your ideas.
Yeah, sure thing. So that's an excellent question. And I think sort of my first answer to that is that's still something we're trying to figure out. And that sort of feeds into this barrier around benefit, as we're still trying to figure out how these devices fit in and what they do well compared to other things. But to give maybe a more precise answer, so we have decent data that some of these devices can help with behavioral symptoms, in particular like agitation. And we've found this in a lot of different settings, including in people's homes. And I can say just anecdotally that I hear from people who email me and say, this is my robot, the cat that I showed at some point. Many people have this and say, wow, that's really helping my wife, stay calm, or really helping my husband when they're having a rough day. And so for those kinds of issues, social robots can have a calming effect. And they can sometimes de-escalate behavioral manifestations of dementia. In terms of communication and social interaction, it's really interesting, but a lot of the best evidence actually comes from a whole different field of research, which is social robots for autism. And that's really where we have the bulk of this data. But in this context, they've been shown to be terrific. And they work really well in terms of helping people with communication, in terms of helping people with social interaction, because the robot it doesn't matter to the robot how you're speaking, what mistakes you're making, what sorts of other social cues you may be missing. And so for children with autism, that's been shown to be extremely effective as a way to facilitate communication, even between people. And the evidence in dementia and FTD specifically is very early days. We have very little information. The bulk of the work has been done in dementias, such as Alzheimer's disease. But there's work that's just being launched every day. And so hopefully by this time next year, there'll be more evidence on FTD specifically.
Well, sadly, we're out of time. Thank you so much for your work. And, we'd love to keep tabs on how the research is going. And I really encourage folks with us today to consider participating in the ways that Julie has offered. So thank you so much for being here with us again.